I'd like to take this opportunity to thank the Child Fatality Task Force members for their laser focus on this critical life-saving effort, along with my primary co-sponsors, Representative and Dr. Grant Campbell, who serves on the Health Committee, Representative Steve Ross, Chair of the Commerce and Economic Development Committee, and Representative David Willis, Chairman of the Education K-12 Committee, for their work and support on this important bill. North Carolina has experienced an alarming increase in the use of vapor and other tobacco products in recent years, now ranking North Carolina 6th in the nation for youth vaping. According to the 2021 National Youth Tobacco Survey, more than 2 million middle and high school students reported using e-cigarettes. Kids get these from older adults, but most are purchased from retailers and vape shops. As a member of the Child Fatality Task Force, I heard firsthand what these products can do to our kids, to our communities, and to our schools. It's for these reasons we filed House Bill 430. This bill has been a lot of work on it. I am honored and proud to be able to file House Bill 430. House Bill 430 will do two things. First, it raises the age to purchase vape and nicotine products to 21, bringing us in line with federal law passed in 2019. North Carolina is one of only 7 remaining states that has not raised the age to 21. This is important because 95% of tobacco users start before the age of 21, risking a lifetime of addiction and chronic disease. North Carolina is at risk of losing millions of dollars through the Prevention, Treatment, and Recovery Services Block Grant if it doesn't do more to prevent underage sales to young people. Second, and more importantly, this bill would establish a retail permitting system for the sale of nicotine, vapor, and tobacco products. At present, we have no idea where vapor products are being sold, nor do we know how many vape shops and retail outlets there are because they're currently unregulated. By estimates, there are approximately 1,200 tobacco retailers, and with my recent conversation with the Secretary of State, she told me that there's an estimated 15,000 vape shops operating in our state. However, this could be more because I only asked if they had vape, vapor, or vaping in their license or their title. So 15,000 just had those 3 words in it. This bill would also work with House Bill 900 that was passed by the General Assembly and signed into law last year. It requires that makers of vape pens and other similar nicotine products to get a certification showing their product has federal approval. The State Department of Revenue would then publish a list of approved products, and retailers could be fined if they sell something that is not on the approved list. This permitting system would also allow our alcohol law enforcement officers to improve merchant education, inspect for responsible retail practices, and level the playing fields for those merchants who are and will do the right thing by carding or verifying anyone under the age of 30. This permitting system does come with an initial appropriation in the first year according to the Physical Research Division, and this is to establish the system within the ABC Commission. However, in future years, these fees for permits would cover the cost of the additional ALE agents and the program. This permit system is modeled after the beer, wine, and lottery ticket process and would be administered by the ABC Commission. The cost for each of these permits would be approximately $400, the same as other ABC permits. This bill has the support of the ABC Commission, the Alcohol Law Enforcement, and both are here today to show their support. I'd like to recognize the Alcohol Law Enforcement Group and, because she's not as tall as I am, the ABC Commission folks that are here today. Thank you for attending today's announcement and to support this important piece of legislation. If you will hold your questions till the speakers are done speaking, that will give us a chance to get the information out. I will be followed by Charlene Zorn, and if you will look to my left, your right, this is a picture of her stepson, who was a victim of vaping and is no longer with us. So I will ask Ms. Charlene if she would come and make her comments.
Thank you. My name is Charlene Zorn, and I am Solomon Solly's stepmom. 641 days ago, my son died from vaping. He was a healthy, active teenager with no underlying health issues. On behalf of Solomon's father, Al, and myself, and our family, I would like to thank Representative Loftis and his fellow lawmakers for sponsoring House Bill 430 and Senate Bill 318, known as Solly's Law. I'd like to tell you a little bit about my son, Solomon. He was a typical kid. He was very strong-willed. He played football as a freshman at New Hanover High School in New Hanover County. He loved riding his bike, playing on his Xbox, going to the gym with his daddy, eating hamburgers and pizza. He aspired to get his first job, to get his driver's license, to go in the military like his daddy, to attend college. Solomon will never get to experience any of these things because of vaping. Solomon went from a healthy high school freshman to a sick kid almost overnight. In March 2023, Solomon saw a family doctor who was unsure what was causing his illness. In April 2023, after a month or so of not being able to get Solomon's healthy again, he was referred to Dr. Kravitz, a pediatric pulmonologist at the Nunley Pediatric Clinic, who immediately discovered that Solomon was suffering the results of vaping. He had air hunger and shortness of breath without any movement. Dr. Kravitz changed his course of treatment several times between April and June. There were many days that he was so weak he couldn't walk from the house to the bus stop. Some days he couldn't walk from his bedroom to the kitchen without getting out of breath. He no longer was able to go to the gym, ride his bike, or hang out with his friends. On June 16th, 11 days after Solomon's 15th birthday, he collapsed at home. 20 minutes after speaking to his father on the phone, his dad got home and found Solomon unresponsive on the floor and had to give our son CPR until EMS arrived. EMS treated Solomon what felt like a lifetime and then transported him to New Hanover Regional Medical Center. After a long emotional night in the PICU, Al, Solomon's biological mother, and myself met with the medical team in the morning as they explained to us that Solomon had suffered from severe hypoxia, which resulted in irreversible brain damage and organ failure. Later that day, surrounded by Solomon's family, he was removed from life support. Solomon died on June 17, 2023 at 15 years old, all as a result of vaping. The doctors had informed us had Solomon not collapsed when he did, he would have needed a heart and lung transplant to survive. That his heart and lungs had too much damage. Solomon was scheduled to see a cardiologist but died 2 days before his appointment. Vapes and other nicotine products should not be available to underage kids. We need enforcement. We need the legal age to purchase vapes and nicotine products to be at least 21 in North Carolina. We need to continue to educate our youth, our parents, our educators, and the general public of the dangers of vape and nicotine products. We need to work together to get Solly's Law passed and to the governor's desk to be signed into law. When I look at these beautiful teenagers from East Duplin High School that are here with us today, I see my stepson Solomon in their faces. I've had the honor to work with these students to help them educate their peers. I'm so proud of the efforts they are making to save their peers' lives. We need to protect the future of our kids. We need to keep them safe, allow them to experience the things that Solomon will not have the opportunity to. Our youth have their whole lives ahead of them, and we need to make sure that nobody else suffers like Solomon did. Over the last 21 months, many people have reached out to me regarding their own children and issues with vaping. Trust me when I tell you, Solomon is not the only child that has suffered from vaping. Our youth are suffering long-term effects from vapes and nicotine products. Together, we need to protect our youth so they can experience a future that Solomon will never have. In closing, I would like to thank Representative Loftis and his fellow lawmakers for sponsoring Solly's Law. Following me is my dear friend, Dr. Toby Gilbert, and it's now her turn.
Good morning. Thank you all for coming and being a part of this monumental press conference that we're holding here today. And thank you, Representative Loftis, for your work and all the others in this room that are working to make this bill a reality. I work with Jacksonville Police Department. I'm a clinical neuropsychologist, and I also am a police crisis counselor with the department. I have prior law enforcement as well. And I'm here to talk a little bit about what vaping does to our brains, and particularly those to our youth. As has been stated earlier by Representative Loftis, North Carolina is 6th in the state for youth vaping, which is just unimaginable to me. When we intake nicotine into our bodies, it is a toxic substance in all ways imaginable. Our brain is the most critical and the most vulnerable to these types of toxins. It is also, nicotine has been found to now be the gateway drug to all other addiction. And for youth, it is now the gateway drug for the potential for mood disorders, attention deficit disorder, and other psychological disorders. The prevalence rate is growing. When nicotine is inhaled and enters into the bloodstream and is delivered to the brain, it is particularly impacting what we call the prefrontal cortex, which is the front part of our brains, which is responsible for our decision-making, judgment, personality, impulse control, and many other factors. Most of us have heard of the neurotransmitter dopamine as it relates to illicit drugs such as Percocet or opioid stimulants. Dopamine is considered basically our party neurotransmitter, right? It's our happy neurotransmitter. When nicotine is released or is brought into the body and released into the brain, dopamine levels increase in our brain, which makes us feel good, makes us feel happy, makes us feel relaxed. In doing that, it now becomes what we all want to feel. We don't want to be depressed. We don't want to be anxious. We don't want those uncomfortable feelings. So we're going to seek ways to alleviate that. And for youth, the easiest way at this point in time has become nicotine through vapes, e-cigarettes, other things. Access to this has become very easy for them, especially given that the age currently to purchase nicotine is 18. These kids, their cohorts, their peers are graduating or turning 18 before they even finish high school. So they're able to legally purchase it, and then they are selling it to their friends and then bringing it to school. Working with Jacksonville Police Department, I have been involved in many cases, unfortunately, that children, youth, when I say children, I'm talking middle schoolers, and our high school individuals, where we have had them overdose from vapes within the school system. I've had one that has talked about selling, and he's very proud of what he sells within the school system. It is very hard right now for our law enforcement, and you will hear a little more about that, to be able to do much about it as the way the current statutes read. So another reason why this bill becomes so very important. We need to protect our youth. As we said, decision-making and executive functions are very poor as we grow older. When we talk about development, we are talking about those functions specifically. So, those of you that are parents understand that teenage years are the hardest because they're becoming their own little independent selves, but they're also trying to make decisions and use good judgment, which generally is not often very good. And they need a lot of direction. Now add in nicotine and what it's doing to the brain, and that decision making and judgment is even worse. they need our guidance, they need our help, and we can't do that in silos. This has to be a collective effort. And this bill and Charlene's unfortunate loss of her son really reflects the need to come together as a community, as a state, as a nation, to protect our youth because they are not able to protect themselves. I appreciate the fact that you all are here and are interested in taking the time to listen to what we have to offer you today. And I just ask that you continue to talk with others and educate. Education is the biggest way to help start to alleviate some of the problems that we have around this. The more you can talk about the effects of nicotine in the brain and on the body is going to be important. The effects socially, economically are going to be important, though adolescents don't always understand that, but they understand when their body changes. So we need to make sure that we're hitting those things with them and encouraging them through education. Again, I thank you all for being here. I appreciate the opportunity, and again, to our representatives and our lawmakers and legislatures for considering this bill known as Solly's Law. I'm now going to allow Jake Peterson from Alamance County Sheriff's Office to come and speak about the law enforcement role.
Oh, good morning. My name is Jake Peterson. I'm a deputy with Alamance County Sheriff's Office. I have a very unique role within the Sheriff's Office. I'm assigned as a school resource officer at Eastern Alamance High School. I'm thrilled to see some young people here today from Duplin County. So I'm sure you guys have a great SRO at your school, which also leads me to my next point. And I'll ask them the question: when you're at school, what do you see in your bathrooms, in your school buildings, as far as vaping?
It's everywhere. You can smell it too.
Yeah, it's very prevalent. I mean, take a stroll down your local hallway into your local bathroom in the school, and you're pretty much guaranteed to find a kid with a vape. So being in the schools every day and being on the front lines, so to speak, my job as an SRO is to help educate, protect, and be a resource to our kids in the school. Unfortunately, I see these things far too often. As a matter of fact, I did a little tallying last night in preparation for this morning. As of yesterday, I've been keeping track this year of my stats, so to speak, of how many vaping incidents we've had. Total of 85 vapes have been seized just at my school. I don't know how many schools we have within our entire state, but multiply that by the amount of schools, and it's crazy. It's ridiculous. It is, quite frankly, unacceptable. As Charlene and Dr. Gilbert alluded to, this is killing our kids. It's killing our kids. It's affecting their brains. It's affecting their ability to learn, to socialize with each other. The kids that are not vaping, they have a hard time even going to a bathroom because there's so much vape smoke in the bathroom. As we as law enforcement know, we know that we can't charge our way out of this because right now there is no charge for having a vape in school. We confiscate them, and the school handles consequences and things of that nature. But with that, my job too, what I've really taken a stance on is trying to educate our kids and let them know what they are putting into their bodies and how it's affecting them. You can see it in their test scores, you can see it in their attendance, you see it in their behavior in the classroom. And if we had our administrators here, I'm sure they would also approve of this message. So just real quick, I have a lot of stories I could tell. We could be here all day, but I wanted to just share a story about a kid that was selling these products at my school last year. This kid had extensive connections from what we discovered, criminal in nature, of course, and also tied into gangs. So that kind of culture is infiltrating our schools as well. I would venture to say that we're all here because we care about our kids and we want to keep them safe both in school and out of school. So we definitely do not need those types of things being in our schools. We've had overdoses in our schools as well. as a result of some of the marijuana vapes that we're seeing. Other products as well that have the marijuana in them. Even just the nicotine vapes, the Geek bars, and the other ones that you see up here on the pictures. I mean, these kids are smoking from these things. They're passing them around to each other. I always tell them, you don't know what that other person is dealing with medically, what sickness they might have that you're communicating to them or getting from them. So, you know, it's opened my eyes to a different world that I don't want my kids to grow up in. And so the passing of this bill hopefully will be something that will keep my kids safe, will keep everybody else kids safe, and that's why we're all here. So I appreciate the opportunity to come here. I'm nowhere near as big of a deal as these two here. They certainly set the stage, and I'm happy that you know, that Representative Loftis and some of the other representatives here are pushing for this bill. It is definitely needed for sure. So thank you for your time, and thank you for allowing me to be here today. Abby, I think Abby's coming up next.
Good morning. I am Abby Emanuelson, Executive Director of the North Carolina Alliance for Health. Since our founding, the Alliance has been committed to reducing tobacco use and exposure in North Carolina. And enacting the Protect Youth from the Harms of Vaping and Nicotine is critical next step to improving the health and safety of our children in our state. We appreciate Representative Loftis for championing the legislation, and Representatives Campbell, Ross, and Willis for being primary sponsors, and Senator Adcock for taking the lead in the Senate. And we also so appreciate the representatives here from the Child Fatality Task Force and for their endorsement and support of Solly's Law. The time is now to raise the age of the sale of tobacco products in our state. The Protect Youth from the Harms of Vaping and Nicotine Act is a powerful move to safeguard our communities and protect our kids. This legislation will establish a permit system for tobacco, giving law enforcement the tools to crack down on illegal nicotine sales and prevent underage access. It will also level the playing field for responsible retailers who already follow the law. Once North Carolina raises the minimum sale age for tobacco and vape products to 21, we will be aligning with the federal law. Should North Carolina fail to effectively prevent underage tobacco sales by the end of the year, we are going to be losing nearly $6 million in federal funding for mental health, prevention treatment, and recovery services. Most importantly, these bills are about protecting our kids from life-threatening respiratory illnesses, brain issues, nicotine addiction, and chronic disease, and preventing another child's life from ending like Solly's. Thank you, Charlene, for sharing Solly with us, and thank you, Dr. Gilbert and Sheriff Peterson, for speaking about the harmful effects of vaping and nicotine addiction among North Carolina's youth today. Thanks again to our sponsors, and we invite all members of the North Carolina General Assembly to support their respective bills in each chamber. House Bill 430 and Senate Bill 318. And we're happy to take any questions. Or did I take your role?
No, you're good. You're good. Questions? Do we have anybody else left to speak?
That's it.
We're good? Okay.
Okay. Hi, I'm Grace Butani with North Carolina Health News. I just wanted to clarify real quick. So this would only apply to nicotine products, correct? Not marijuana products?
Right now, it is a nicotine-centered bill.
Okay, gotcha. And then also a quick follow-up. I know that y'all said that this bill has been a long time in the process. What has been past opposition to the bill, and if any? What are you worried about, if anything, this session and getting it passed? And that's for anyone.
You can speak from the Alliance side, and I'll come back.
It's just also a big concern about limiting access to tobacco in the state, as well as the fact that it does provide a permit fee has been the opposition.
I think politically, North Carolina has been known as a tobacco producer for, let's face it, hundreds of years. I think the timing is right for now that the paradigm is shifting. Tobacco is not our number one crop. So we now know and are seeing the effects of vaping that have shops on almost every corner back home. And we see the effects of this right here. And so I think the timing is right, that people are aware of the impact of the age of brain development. So I think the timing is correct. The public is ready for this. There will be some naysayers. However, our kids are worth the effort to invest in changing the law. 43 other states now have the age of 21 for tobacco and alcohol. We're one of 7 remaining outliers. So I think there is evidence that we need to impact the future of North Carolina's children. Someone else? Yes.
A lot of people say, well, there's a federal legislation, so why do we need to change it at the state level? Talk about like what confusion it causes not having it.
So if I'm headed to answer your question, please let me know. If I'm not, please say, nope, back over here. So right now, the federal law says it's 21 to buy tobacco, it's 21 to buy purchase alcohol. In North Carolina, we said we will allow 18-year-olds to do that. However, vaping is a new industry. The impacts of vaping has suddenly made an appearance on the health of young people that we didn't see in normal tobacco products because it's being used differently as a vaping product versus filtered cigarettes. So I think the changes of, if you have a refillable vapor product, you can put anything in that product you want that's a liquid. And so what we're trying to do now is to identify the vape shops that are selling this across North Carolina, allowing regulatory enforcement to say, if you're under the age of 30, we're going to card you. We're going to make sure you're of legal age to be able to do that. And so I think it's a different environment chemically. So marijuana can come in a liquid form. It can't prevent you from putting that in your vapor product, and now you're able to do marijuana in that extent. So I think it's more than just the tobacco nicotine. This vaping is so much more impactful, and the THC ingredients and the Delta 8s that are also a part of that is so much more impactful.
Well, that's great.
Sure.
One more question. So, you know, we did a documentary on teen vaping.
Yes.
WRL, and I interviewed lawmakers, and they would not take a stand. They would not say the age should be raised. Are you worried others are going to do that?
I respect my colleagues on the Senate side and the House side. They get the vote on this issue. I'm saying the juice is worth the squeeze. If not now, when? And if not me, who? Because it's important that we get the conversation on the table and we start really recognizing I'm a very big personal freedom choice guy. I spent over 30 years in the military defending the freedom of speech and the freedom and liberties we enjoy. However, if I had a teenager right now, I would be desperately concerned who she hangs out with, who he hangs out with, and the impacts of vaping on my child. So I'm willing to put myself out there and say it's time to have the conversation. And my colleagues who are my co-sponsors, if you notice, one was an education chairman. If you noticed, one was on the health committee and a doctor. If you noticed, one was on the commerce and economic development committee. That wasn't by accident. That was to say, I need a commitment from these areas that we're going to work together to change North Carolina's future. Anyone else? Yes, sir.
Hi, I'm Ben Humphreys. I'm from NNC. Sheriff Peterson, you mentioned that you had taken 85 vapes in the year. Is that the academic year or the...
This school year. I'll clarify, I'm not the sheriff. I'm not the sheriff. I did not get a promotion from being here, so I'm just a deputy. That's just from my school, and that's only because I like to keep track of it and to see, you know, and quite frankly, my goal is, and I've explained this to, you know, some other people in this room, next year, at the start of the year, I'd like to do some sort of educational awareness for parents to show them, hey, look at all these. I mean, this is what is available possibly here at the school and also in your local communities that your kids are getting a hold of, and you may not even know about it. But yes, I will clarify, I'm not the sheriff. But that's my roundabout number that I've come up with, and that's just from me. I've talked to teachers, and they say that they've seen kids doing it, and or they suspect a kid doing it, and they just tell them to get on a get to class or whatever. So there's way more than that out there for sure. But
also, have you seen different reactions from students to different types of enforcement you're talking about? Like schools might reprimand kids for having vapes versus you.
Depends on the kid. Yeah, honestly, it depends on the kid. I think some of our frequent flyers, they really could care less because they're going to do whatever they want to do. I've caught the same kid multiple times this year, but the kids that you can kind of get down on their level and tell them, hey, listen, like this is what you're doing to yourself. This is what you're setting yourself up for the future. I like to tell kids, bring it to a financial standpoint, because kids are always talking about how much money they want to make and what they want to do. I'm like, well, when you commit your life to being addicted to this stuff, how much money are you wasting and putting it down the drain by putting this stuff in your body? So that kind of brings it back to them in that capacity. So there is an opportunity to make a difference there, and I like to talk to kids about that.
So 85 yes. Calendar year or academic year?
Academic year, yeah, from the start of the school year.
And then I actually had a question for the representative from the ABC Commission. Hi. Hi, how are you? Could you say your name and title? And also my question was, y'all support it. Are you going to be able to handle a new permitting system? What would that kind of look like for the commission in terms of capabilities?
So my name is Missy Welch. I'm Director of Programming for the ABC Commission. So I oversee the permits, product, and audit sections for the commission. And as Representative Loftis stated, we are prepared to start issuing permits per the legislation if passed. And we are looking at updating our permitting system in order to do that.
Hi, my name is Julie Anderson, and I have a question, actually two. Has this bill already gone before committee? And if not, when will it go? And once it is voted on, and let's say it does pass, when will it take effect?
So this bill, we had the House Bill 425. We had that filed Monday or Tuesday. But because there were some disclaimers that was left out of that bill, we rewrote that bill and refiled it as House Bill 430. So the plan now is the Speaker and staff will assign it where it goes through committee. I'm sure we'll go through Commerce probably, or Health, and different committees. So this is just the very first part of this process, is filing the bill. Once it makes its way through committee, it will end up at Rules for the House before it gets voted on the floor. Once that happens, and this bill could take many different shapes, because it could get amendments, it could get a proposed substitute. Once it gets passed out of the House, then the companion bill in the Senate side marries up together, and then it would go to the governor, I'm sure, probably for a signing into law. And was that both your questions? Or cool. Anything else? I'd like to take this opportunity to thank Peg O'Connell, who has been a very, very good person to help me understand more of how this bill works, who are the players or the people engaging and involved with this. Without her help, I don't think we would be here today. So Peg, thank you for impacting the future of North Carolina through your efforts.
Thank you, Representative.
We appreciate that. And for the folks standing here with me and the folks who are around the room, thank you so much for your investment of your time today, because it is about our future. And I'm committed to doing all I can to make sure it's as bright for them as it was for me. Thank you so much for sharing Solly with us and that story, because this is the human part of this whole thing is about our kids. So if we don't invest in them, where do we end up at? So thank you again. We appreciate your time. I look forward to moving this bill forward and my colleagues supporting it in the House and the Senate. Thank you.